there's a silent epidemic happening in senior healthcare, one that's rarely addressed, even in the best hospitals. Every year, more than 50 million older adults globally undergo standard medical checkups, believing they're doing the right thing to stay healthy. But recent data from the Journal of General Internal Medicine and The Lancet reveals a troubling trend. Over 43% of routine diagnostic tests in people over 70 lead to overdiagnosis, anxiety, and treatments that offer little to no benefit. Even worse, many of these tests increase the risk of hospitalization, infections, or permanent side effects, and yet, nearly 94% of seniors are never informed of these risks beforehand. One of the most commonly performed screenings, ranked number 1 on our list, is now linked to an estimated 5.8% of all new cancer cases in the United States, according to a 2023 review by the American College of Radiology. That's roughly the same risk as drinking 2 glasses of wine every single day, and yet, most seniors are never told about the radiation or follow-up dangers involved. You won't find this warning in a doctor's office pamphlet, or on a health system's website. The truth is buried in academic journals and whispered at conferences, not where everyday people can access it. In this video, we're revealing 5 common health checkups that seniors should think twice about after age 70. Backed by current science, these tests may do more harm than good, especially if you're not showing symptoms. And what we uncover at number 2 will likely change how you view one of the most popular cancer screenings of all time. But before we get into it, tell us in the comments where you're watching from, your age, and whether you've ever questioned a test or regretted a medical procedure. Do you think the elderly are being overtested in today's healthcare system? We read and reply to every comment with tailored advice to help you and your loved ones make safer choices. And while you're here, don't forget to like this video and subscribe to our channel. We share the latest evidence-based health insights to help you take control of your well-being without unnecessary risks. Now let's begin with the first test, one that appears routine but could quietly compromise your long-term quality of life. Number 1. Annual full-body CT scans. Full-body CT scans, which are sometimes offered as part of executive health packages, or as preventive services in private clinics, are marketed as a way to catch cancer early. But here's the shocking truth. These scans expose your body to a high dose of ionizing radiation. For older adults, especially over 70, the risk of triggering unnecessary follow-ups, biopsies, and even surgeries is incredibly high. And the irony is there is zero evidence that full-body scans without symptoms save lives. Each scan delivers between 10 to 20 millisieverts of radiation, which is equal to around 500 chest X-rays. According to a 2023 modeling study published in JAMA Internal Medicine, the rise in CT scans across the United States may now be responsible for up to 5% of all cancers, putting them on par with alcohol as a cancer-causing factor. That means 1 out of every 20 cancers could be caused by a scan that was supposed to prevent disease. That's not just counterproductive, it's terrifying. The scan can detect harmless nodules, calcifications, or cysts that are simply part of aging. But the moment they are seen, a red flag goes up. More scans follow, then biopsies, then panic. Let me tell you about Marcus, an active 80-year-old who used to teach martial arts to younger seniors. He felt great and took part in a senior elite checkup at a private clinic. His full body scan showed a tiny 3 mm long nodule that set off a chain reaction. He was referred to oncology, sent for a PET scan, and eventually underwent a needle biopsy. The result, benign, but the biopsy collapsed part of his lung, leading to hospitalization and a 2-month recovery. All for something that could have been left alone. Experts now advise that full-body CT scans should never be used for general screening in asymptomatic adults. The American College of Radiology is clear. There's no proven benefit and significant potential for harm. If there are symptoms like unexplained weight loss, coughing up blood, or visible swelling, then targeted imaging makes sense. But scanning the whole body with no focus is like searching for treasure with a landmine detector. You may find something, but the damage could be worse than what you were trying to avoid. A safer, smarter approach is listening to your body. You feel well, maintain regular checkups with your primary doctor and only do tests that are clearly indicated. Your time, energy, and health are too valuable to waste on fear-driven screening that could leave you worse than where you started. Number 2, colonoscopy. You probably didn't expect this one, but colonoscopy, which is a procedure that uses a long camera to examine your colon, is not always a wise choice after age 70 and almost never recommended after 75 unless there are specific symptoms. The risks go up with age. The preparation is harsh, involving strong laxatives that can cause dehydration, dizziness, or kidney issues. The sedation used during the procedure poses added risks to brain function in older adults. And perhaps most surprisingly, the test itself can cause complications like bleeding, tearing, or even heart rhythm disturbances during sedation. A 2019 study in JAMA Internal Medicine followed over 1.3 million Medicare patients aged 70 and older. They found that for every 1,000 colonoscopies done in patients over 75, only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. And even when polyps are found, many are small and slow-growing. Removing them in an older adult can sometimes do more harm than leaving them alone. Dana was a 73-year-old grandmother who ran a small bakery with her daughter. She had no symptoms, no bleeding, no changes in stool, and no family history of colon cancer. But her new primary doctor, fresh out of residency, urged her to get a screening colonoscopy. She agreed. During the procedure, a small polyp was removed and she was sent home. That night, she experienced intense abdominal pain and fainted. At the hospital, they found a bowel perforation. She spent 9 days in recovery, lost 10 pounds, and hasn't been the same since. When we reviewed her case, we found she had already had 2 clean colonoscopies in the past. There was no reason to repeat it. The U.S. Preventive Services Task Force currently recommends stopping routine colon cancer screening at 75 for most people. For those in excellent health, a stool-based test like the FIT test, which is a non-invasive fecal test done at home, is often a safer option. It has no prep, no sedation, and still catches most concerning cases. Ask your doctor about alternatives because once you're in the colonoscopy pipeline, it's hard to get out. And now we've reached the most overused, most dangerous, and most harmful checkup for seniors, and you've almost certainly had it done. Number 3, cardiac stress test. It's one of the most common tests given to seniors complaining of mild fatigue, chest tightness, or just not feeling like they used to. The cardiac stress test, which is a procedure that monitors your heart while walking on a treadmill or being given medication that simulates exercise, is meant to spot blocked arteries. But after 70, this test often does more harm than good, especially when used on people who don't have any clear signs of heart disease. That's because it can lead to false alarms and unnecessary heart procedures that carry serious risks. The problem is in the accuracy. Studies show that in adults over 70, the false positive rate for stress tests, meaning the test says there's a problem when there isn't, can be as high as 40%. That leads to follow-up tests like angiograms and even unnecessary stent placement or bypass surgery. In 2017, a major study in JAMA Cardiology found that more than half of all stents placed after stress test referrals were done in patients who had no real symptoms or benefit. And those patients had no improvement in survival or quality of life after the procedure. What they did have, however, were higher rates of bleeding, kidney injury from contrast dyes, and prolonged hospital stays. This happened to Raymond, a 75-year-old retired postman who stayed active by walking every day. During a checkup, he mentioned he sometimes felt tired on hills. His doctor scheduled a stress test just to be sure. The results were unclear, so he was sent for a catheterization, which is a test that inserts a tube into the arteries to check for blockages. A mild narrowing was found and a stent was placed. But that night, Raymond had a reaction to the contrast dye and developed kidney problems. He spent 6 days in the hospital and needed follow-up care for weeks. The fatigue never changed because it wasn't a heart problem to begin with. He was simply an older man who needed better hydration and more rest between meals. If you're over 70 and not experiencing classic cardiac symptoms like chest pain during activity, shortness of breath on exertion, or a significant drop in energy during light exercise, then a stress test may do more harm than good. A better option is often a resting EKG, which is a test that looks at the heart's rhythm while you're still, or even a coronary calcium scan, which is a low-radiation imaging test that shows whether dangerous plaque is building up. These are safer, simpler, and far less likely to push you into a procedure you didn't need. Number 4. Brain MRI for memory loss. When older adults start noticing moments of forgetfulness, like misplacing their glasses or struggling to recall a name, their first reaction is often worry. Is it dementia? Could it be Alzheimer's? Understandably, many doctors respond with a quick solution: order a brain MRI. But the reality is far more complicated, and more dangerous, than most people realize. While MRIs can provide detailed images of brain structure, they rarely give helpful answers when memory loss is mild. In fact, for people over 70, these scans almost always show common signs of aging, such as mild atrophy or benign white matter changes, which are not indicators of disease. Here's the problem: once these harmless findings appear on a report, they can set off a domino effect: fear, more tests, and even surgery. A 2023 review in Nature Reviews Neurology analyzed data from multiple cohorts and found that up to 89% of seniors undergoing brain MRI for minor memory complaints showed age-consistent abnormalities, but fewer than 4% had findings that were clinically actionable. Even more troubling, around 14% were referred for invasive procedures, such as lumbar punctures or biopsies, based solely on ambiguous results. That means thousands of seniors each year go through emotional distress, and sometimes physical harm, for changes that were never dangerous to begin with. Consider Martha, a 72-year-old retired librarian. She came to her doctor concerned about occasional forgetfulness. Her MRI showed white matter lesions, a term that sounded terrifying. She withdrew from social activities, stopped volunteering, and spiraled into anxiety. But after a thorough cognitive assessment, it turned out her memory and attention were completely within normal range. Once reassured, she refocused on improving her sleep, nutrition, and began doing daily memory games. Within 2 months, her confidence and clarity returned. Unless there are clear red flags, like sudden personality shifts, seizures, or rapid mental decline, a brain MRI is rarely the right first step. Instead, experts now recommend starting with a standard cognitive screening, such as the MOCA or MMSE test. These paper-based exams take just 10 to 15 minutes, cost very little, and provide a much clearer picture of actual brain function without triggering unnecessary panic. Before we move on, take a deep breath, because the next test is even more common, and may have already been done to you more than once. And it's number 4 on our list for a reason. Number 5, bone density scan. It sounds harmless. A quick scan, no pain, no needles, and you walk out knowing whether your bones are at risk for fractures. But here's what no one tells you. Past the age of 70, a bone density scan can often create more fear than benefit. This scan, which is officially called a DEXA scan, measures how strong your bones are. It's primarily used to detect osteoporosis. But in older adults, especially women, the results almost always come back showing lower density, even when there's no real danger. That's because bone loss is a natural part of aging. Just like wrinkles or gray hair, it happens to everyone. And yet, many seniors are pushed into taking medications like bisphosphonates, which are supposed to strengthen bones, but come with serious side effects like jaw necrosis, which is a rare condition where the jawbone starts to die, and esophageal irritation. Now, here's the problem. Studies have shown that treating mild bone loss in people over 70 with medication has little to no impact on actual fracture rates. A study published in the Journal of the American Geriatric Society followed over 1,200 women over 70, and found that bisphosphonates reduced fracture risk by only 0.3% after 5 years. That's not nothing, but it's far from life-saving. Instead, those women were far more likely to suffer from medication side effects, including digestive issues, inflammation in the esophagus, and brittle bones that break in odd ways. Let me tell you about Rose, a 76-year-old retired piano teacher who was referred for a DEXA scan after her annual checkup. She had never had a fall, no pain, and walked daily. Her scan came back showing osteopenia, which is a mild reduction in bone density that is not considered osteoporosis. Her doctor immediately started her on alendronate, which is a bisphosphonate. 3 months in, she developed severe reflux and jaw pain. By the time we saw her, she hadn't played piano in weeks. We took her off the meds, started her on a regimen of vitamin D, weight-bearing exercises like resistance bands, and a calcium-rich diet with foods like sardines and leafy greens. A year later, she was back to performing recitals with stronger legs, better balance, and 0 fractures. A short scan may seem like a smart move, but for people over 70 who aren't falling or breaking bones, the better option is lifestyle. Strength training, balance exercises, proper nutrition, and treating vitamin D deficiency have been shown to reduce fractures by over 20% according to a 2022 Osteoporosis International study. Don't let a number on a screen scare you into treatment you may not need. But there's one scan that can lead to something even scarier. Brain surgery. What we choose to do, or not do, with our health matters more than ever after 70. The truth is, longevity isn't just about catching every possible issue early. It's about knowing when a test helps, and when it hurts. In an age of overdiagnosis and overtreatment, the most powerful thing you can do is ask smarter questions, stay informed, and make choices that protect not just your body, but your quality of life. You don't need a full-body scan to know if you're healthy. You don't need invasive tests to prove you're strong. What you need is clarity, balance, and the confidence to say, I trust my body, and I understand the risks. Prevention isn't about fear, it's about wisdom. And wisdom comes from listening to real science, not just routine. If this video helped you see things differently, share it with a friend, a parent, or someone you love. Because the best kind of healthcare is the kind that empowers, not scares, you. And if you're new here, make sure to subscribe and turn on notifications. We bring you honest, evidence-based health content every single week, designed especially for those who want to age smarter, not just longer. Thank you for watching, stay strong, stay sharp, and we'll see you in the next video.